I think the training is important because it's one of the elements of a provider's performance. That a well-trained provider knows the updated information about the contraceptive methods that they're going to be providing to their clients. They also need the skills in order to be able to provide it safely. And training can also be somewhat motivational for them, that if they know that they're being supported to improve their performance, that they can always, if they need information, if they need to update their skills, that there is always a way to do that one. So to me, I think training is important, but we have to be looking also at the other performance factors that support a provider's provision of services. Well, the way I define a successful family planning program is that it is able to meet the needs of its clients or coming from the community that the family planning services is serving. It also means that the providers in that family planning clinic have the knowledge, have the skills to deliver the services in a high quality way. Now, it also means that there are supplies, there are commodities, and that they can give it to clients correctly when they need it. I think the role of the program manager here is critical in identifying how well the performance or how well the providers are performing according to the standards that they have set for the clinic. Part of the role of the program manager is also to provide support so that when providers are not meeting their performance standards or the standards of care that the clinic is providing, that they are able to access or able to identify ways to support these providers. So I'll give you an example. So for example, if a provider has been well trained or just came back from training, let's say on IUCD or intrauterine contraceptive device training, when they arrive in the clinic, what the program manager can actually do is make sure that the equipment, the instruments, the supplies are available to this newly trained provider. Second part is also to take a look at, well, let's take a look at the policies. Are the policies there or the guidelines there in the clinic that allow this provider to provide the services? How about supplies? Supply of the IUCD. Is it available in the clinic for this newly trained provider to use with their clients? The other aspect is also taking a broader look at when you have newly trained providers is, are there opportunities for them to practice? So that also means trying to figure out how do you reach out to the community to communicate to the community that there are new services that are available in the clinic. So in this case, like IUCD. So it's working with the other cadres in the clinic, the health educators, the community health workers or the voluntary health workers to get out the message. We have a newly trained provider who can insert the IUD, a long-term method, safely, and it's going to be good for you. If you want these services, come to the clinic and you'll be taken care of. So there's a lot of things the program manager can do to support the performance of a family planning provider. It's one of the most common actually that I see very often is when it comes to counseling. Counseling when it comes to communication skills and being effective in using their limited time to be able to get the maximum out of the interaction between the provider and their client. The other deficiency that I frequently see is in the area of infection prevention practices, whether it's the routine hand washing that you need to perform before and after seeing a client, or the processing of instruments correctly from used instruments down to storing these processed instruments. There's a guideline or there's a definite path as to how these instruments need to be handled so that it is safe for the cleaners and it is also going to be safe for the clients when they're going to be used later on, and also safe for the provider when they're going to be using it. So those are the two main common deficiency that I see. The other thing is also to take a look at, it may not be a deficiency, but it may be more of like an approach to working with their clients, which is attitude. The attitude of being supportive, being friendly, and helpful to their clients. Again, we have to take this into context of their work. More often than not, in a low-resource setting, there's just a huge number of things that they need to be doing in a limited period of time. But we also do see a lot of providers who are happily and satisfactorily doing their work.